Welcome to the Ultimate Dentist podcast. Join us to hear success stories of various individuals and learn clinical and life hacks to help you become the ultimate dentist. So hi everyone, we have today Ferhan, and I am privileged to have Ferhan in my podcast. Ferhan had made a big impact, huge impact in my life, and I was talking to Ferhan just now, and I was telling him that you have few decisions you make in your life which change and shapes your life, and one of the decisions I made, which was meeting Ferhan and following his advice, and that has impacted my career hugely. So I know how busy Ferhan is. So thank you, Ferhan, for joining me today. And for those small number of people who don't know you, could you please introduce yourself and tell us who you are and what you do right now?
Hello, everyone. Thanks, Dev. Thank you so much for the invite and those kind words. What a privilege it is to be on the podcast and being able to share a discussion with you and your audience. So I suppose the best way to sum who I am and what I do is my name's Ferhan, as Dev has already told you, and I'm an implant surgeon who has a passion for education and training in the field of implant dentistry, with a particular focus on full arch implants. But I don't like to really put myself into that a box or category, and I think it's important that we sometimes try to stretch what we are as individuals. So I often cringe at being called an implant dentist or thinking myself as an implant dentist, and I want to, because I feel there's more to me, and I encourage people to think that there's more to them than just confining themselves to a single profession. So I like to think of myself as a creative, someone that's always trying to push myself and others to really make a big an impact as possible. So at this moment in time, I have a particular focus on education. I'm a practice owner. I'm a father to two kids. I'm a husband. I'm a son. And I'm just really trying to really push myself to be better all the time. So that's me.
Well, thank you very much, Ferhan. So in this podcast, what I am trying to do is I'm trying to capture people, a dentist journey, and to people who really want to model you. So, if I want to model someone, I want to really know their journey. I would like to know how they, what were the struggles, how they went through, so I really understand them properly. So, could you tell us about your journey? As we all know that you not only a dentist, but you are also a doctor. So, could you just give us some idea as to, from your A levels, how did you decide to become a doctor, and what then motivated you to join dentistry?
So I suppose it all kind of starts from early teens. I'm one of five. My parents are migrants, originally from Pakistan. My dad's a shopkeeper, still works as a shopkeeper today. And naturally, growing up in a very traditional household, I had three options growing up: a doctor, lawyer, or a failure. And, education was something at the tip of my dad's tongue every single day. And that's what I remember him saying: study, study, study. Really, really pushed us. And I remember going to the shop with him to work with him. And it was his way of putting me off a career or a job or a profession like he had, and encouraging me and my other siblings to study, study, study. But a lot of me growing up, I wasn't really keen on a career as a doctor. I was primarily put off by my GP growing up, and I just had this sort of tunnel vision of what it was, what a career as a medic was. So me and a number of people in my year at school, we all got together and we did dentistry. And it was great fun. I did some work experience, but I didn't really know what I was getting in for. Some people allude to the fact that, you think it's a good job and you get paid well, etc. I don't know if that was the case, if that's what I was thinking when I was growing up. It was just me and my mates. We all went to dental school together, and it wasn't medicine. And my parents would still be proud because I'd have doctor as a title. And that was really why I did dentistry. And, dentistry was a struggle. That step up from higher education to university level education was a real struggle. And first year of dental school was tough. It really was tough. I barely passed by a couple of points each subject, and I was very close to being called or summoned towards pass-fail vivas. But that really gave me the kick up the ass to really knuckle down. And then from second year up to fifth year, I really pushed on and really did do well through my studies, and there was no challenge getting through. So dentistry was fun. I was still living at home, so I was at Glasgow University. However, you come out and again, you're unaware. You really are unaware. I was anyway, of what lies above and what the possibilities are in terms of in your career. So again, safe option. I entered a 2-year training program, which gave me a good variety of exposure to general practice, community dentistry, and hospital. And really, the big or the monumental change or the monumental significant moment that really changed my career and the trajectory of my career was working as a senior house officer within a really busy maxillofacial unit where I was around really inspirational individuals, surgeons dominating. They had a personality, sometimes positive, sometimes negative, but they had personality. They really stood out to me, and they were dual qualified. And I looked at them, and they did cool surgery, and I looked at them and I thought, I want to be like them. And to be like them, naturally, I had to go back to university to do medicine. But I was like, maybe I'll just see if I really want to do this. And then I did another year as a maxillofacial SHO. I applied, and the only place I got into medicine was Liverpool Medical School. So I entered the 4-year graduate program. So off I went, left home. And medicine, as a dentist, doing medicine was a real challenge. It wasn't a challenge from the point of view academically. Getting through medical school was pretty straightforward, thankfully. It was just balancing everything. I had a mortgage, so I bought a flat when I moved down to Liverpool. The real challenges were personal and financial, trying to make everything meet, school fees, fund myself. I had to work weekends, had to work night shifts. I was working in the northwest of England. I was working up in Scotland, 48-hour on calls, etc. But those moments, juggling everything, really, I feel if I look back, made me the person I am now, because I just got on with it. I was financially, I was pretty skint. I remember a time I had to borrow money off my brother to pay my mortgage payments. I was skint, but I was happy, just juggling everything, just booking in shifts, turning up to clinic a bit late because I'd been on call at a local hospital. But it was fun, it was really fun. And it was good to be amongst a graduate group of other like-minded individuals that were doing medicine. And then one thing led to another. And then I finished med school. And naturally, I was like, right, I'm going to now do F1, F2. So I moved back up to Scotland to do F1 and F2. And before I finished med school, I got married, just to throw that, just to add complexity to life. I got married and I did F1, F2. But towards the end of medical school, I really thought to myself, I want to do medicine, but I reflected back, I didn't just do medicine to follow a career in maxillofacial surgery. I did medicine also to further myself, to increase knowledge, and it's something that would never it wouldn't be nobody could take that away from me. And I would always benefit from having done it. And even if I told myself, even if I didn't follow a career in maxillofacial surgery, it's okay. I'll always, my career wouldn't be, there wouldn't be a detriment or negative effect of having wasted 4 years I'll be able to build on this. And even if I went down and went back to dental practice, I'll still benefit from the 4 years at medical school. So towards the end of medical school, I was starting to think about, sort of bypassing max facs and looking at options going back into primary care, carrying out dentistry. But when you leave medical school, you get access, or you get entry into a 2-year program, just like I did when I was qualified from dentistry. So I did 2 years as an F1, F2. I did a variety of stuff: general medicine, A&E, general surgery. A lot of fun. But as fun as it was, it had a huge impact on my life in terms of personally, just because of the night shifts, etc. It's just not great fun when you're in your early 30s doing late night shifts or doing really random shifts in A&E. And that really cemented my decision to step away from medical training and a career in maxillofacial surgery and look at options within dentistry. And I was lucky because I had friends and people I knew getting together that were building a group of dental clinics, and I got involved in a partnership. And actually, on that note, when I was in FY1, I bought a dental practice because, I don't know, I had an opportunity and I thought, oh, why not? And while I worked as an FY1, I also ran a dental practice at the weekend, which was a small referral practice that would really cater for a lot of oral surgery and sedation services within the Edinburgh area. And so one thing led to another. I was involved in this dental practice, and we quickly built up to a group of 7 practices, and I was one of the partners. And my responsibility was looking after the oral surgery and sedation services, because that's all I really knew. After dental school, I did VT and I did some general dentistry, obviously, in VT, but after that, I had very little exposure to general dentistry. All my experience was surgical dentistry. And so really, when I came out of med school, I had to look at what did I know. I knew surgical dentistry, and so that's what I offered my partners of the group of practices. So I was sort of lead dentist for the surgical and sedation services, and that's what I did. And then naturally, one thing leads to another. Like anything, you're always looking to build and bring in new skills to your repertoire. And I always say to people, the basics or the foundation for implant surgery is good surgical dentistry, oral surgery. And so I was very, very competent in doing oral surgery. And then one thing leads to another, and I started doing implants. I was lucky I was around a good group of people to help me, support me in my implant journey, doing simple implants, more complex implants, etc., etc. One thing leads to another, and then I ended up doing full arch implants, then started doing more and more complex full arch implants, and then started getting into teaching, and a lot of teaching. And now presently about 80 to 90% of my work is teaching. And I think obviously I've always known that my passion, my true purpose lies within the education and training side of things. I really get a buzz out of being able to help other clinicians learn and develop. And I love seeing them being able to do the work that I can do and ultimately surpass my level in the work, the kind of work I do. That's the absolute ultimate. And I'm very fortunate now in my training community. I help tens of implant dentists upskill and learn full arch implants, to the point where they quickly are starting to do this type of work independently. So yeah, that's really the journey clinically. I started dental school in 2000, and I finished in 2005. I finished medicine in 2012, and I've been in general practice for the last 8 years since I left foundation medical training, and it's been crazy. It's been just an absolute whirlwind, and I wouldn't change it for anything. But at this present moment in time, I'm no longer a partner in a group of dental practices. I have my own practice in Edinburgh, where I service the implant needs of the referred patients. I work there Monday, Wednesdays, and the rest of the time I'm teaching, and I travel all over the country, from as south as Exeter and Brighton, and as north as Oban and Turriff in Scotland. So I go wherever and anywhere, and I'm very fortunate to be asked to lecture on a quite frequent basis. And next week I'm in Rome for the European 𝗙𝗂𝗋 meeting, where I'm talking about full arch implants to hopefully quite a large audience. So yeah, I mean, I never for a moment thought that I would be where I am, and I'm extremely grateful that people have helped me get to where I am.
Yeah, so it's quite a journey, quite a roller coaster. You know, you've been so busy. So one of the question I had was, when you were working in, doing your medicine, you were saying you were working weekends. What type of job were you working as a dentist, or you were working? What type of work?
Yeah, so the majority of when I was at medical school, I formed really good links with different maxillofacial units. So obviously the maxillofacial unit that I was working as a dental SHO up in Scotland, the west of Scotland, I had links there. So I would do some local shifts for them. Where I was in Liverpool as a medical student, I quickly built up links, and they were always looking for dentists who were now studying medicine as their second degree to come and do on-call shifts. So I quickly built up relationships with the clinicians there. So primarily most of my work was as a maxillofacial senior
from the beginning.
Yeah, from the beginning. And I sort of try to focus most of my work around there, because it was good to start to build that network, because I knew when I was coming out of training, I'd be looking for a training post. And if I was liked, if people knew who I was and knew what I was capable of, then they would have certainly helped me get my desired position.
And I'm sure you get this question asked a lot, probably, and it's difficult to answer. But I just wanted to ask that, looking backwards, do you think you would have done anything differently? Because I know that who we are is shaped by our past, right? So I strongly believe in that our experiences shapes our future. But let's say you have a magic wand and you go back, knowing what you now know. Do you think you would do anything differently?
For a long time, I thought if I could go back, I should have just done medicine the first time round. I mean, I remember applying for medicine and getting in. And my dad always wanted me to be a doctor. I mean, he didn't really admit to that until I applied to do medicine and then got into medicine. And he goes, "Why didn't you just do that first time round? And just you're getting and work and practice." And he's like, "Yeah." And so, but for a long time, I often asked myself, what if I just did medicine the first time round, and I could have gone down F1, F2 surgical training and did ENT orthopedics or something. I would have really enjoyed that. That would have been great. But as you said, Dev, now at this present moment, looking back, I look at it all as learning, as growth, as really the obstacles, the experiences that have shaped me who I am. And I'm happy with who I am right now, and I'm very fortunate. And so I wouldn't change it. But there were times where I thought, I should have just done medicine the first time round, because a lot of what held me back from pursuing a career in Max Fax was I was in my early 30s and I just couldn't be bothered with doing surgical training. Again, F1, F2 was hard enough. You're 31, 32, and you're with people, no disrespect, they're 23, 24, and you work, and it's tough going. And then I would be doing that for the next sort of 4 years through surgical training, and the lack of autonomy, the lack of control in terms of training. And then even when you get to consultant level, the mono specialization within a particular specialty. And so you can devote a decade to training, and then you may not get to do what you thought you wanted to do. And there was too much uncertainty. And I said, it was a good time to get out, and I stepped away. And there's absolutely no regrets about that.
Yeah, I mean, I also believe, I think many times we learn while we do something, and rather than staying in the system, sometimes learning slows down, especially, and that's why, when I teach full mouth reconstruction, I tell people that you don't have to be a specialist, you don't have to be you're doing MSc diplomas and stuff. You can learn with a good mentor. Having a good mentor, you can learn full mouth reconstruction. But obviously you were more than qualified to do full arch dentistry. Now, could you just enlighten us with your simple, let's say someone wants to, you have mentored me on full arch, so I know how the system works, but for people who don't know how things would work, how would it work if someone wants to reach out to you and mentor you? I'm sure you have a system. I know you have a system. So could you share with us how would that work?
Yeah, sure, Dev. So most people reach me through word of mouth, or they've seen me on social media, etc., or maybe someone in their circle of friends is doing full arch, and they're like, "Who's teaching you? Who's helping you?" And my name comes up, and then people reach out to me. It all starts off with an initial call. And it's like a discovery call. So I really need to get to know the clinicians that want to work with me. And actually, it's a two-way process. It's a partnership. So I need to get to know who they are, where they're coming from, what their experience is, what level they're doing implants at this present time, what they're hoping to achieve. I need to get to know their environment. And they need to understand the process of learning something that is particularly complex. And it's not for everybody. And a number of people I don't allow or say it's not the right time for them right now. And that's based on experience. It's based on their aspirations and goals. And I don't take them on. And it's not a hierarchy. It's not that I think I'm special. Naturally, I have to be an ambassador. I have to be protective over what I teach and the technique. So I have to be selective in who comes on board. And when people come on board, we're on a journey together, and everybody is on a journey themselves. With me personally, it's not a competition with other people on the group and the community. We go as slow or as fast as they want, and we take it nice and slow. So I suppose the best way to sum it up is it's in essence a 5-step process. There's the discovery call. I need to get to grips with the sort of belief that an individual clinician has in themselves and their confidence level, what their mindset is like. Then naturally I need to go through the theory aspect, and a lot of that happens online. And then as and when cases come about, are identified, and I help clinicians identify cases. We talk through cases, then we book them in, then I come down, we do one-to-one mentoring, and that's repeat until an individual becomes more and more competent, and then I can start to virtually mentor you. Maybe I'm there for support, maybe I'm just there for case planning. And all that during sort of steps 3 and 4, you're always part of a community of like-minded people that are on a journey. Some are earlier, some are in the same position, some are further on. But I believe that we learn better together. So I'm a big supporter of trying to build a community where we're all learning together. And yeah, I mean, it's my program and I put it together, etc. But I'm only the gatekeeper, I'm only the instigator. I stimulate discussion, etc. The community sort of looks after itself. People are posting cases, people are sharing ideas, people are posting their cases that they are now doing independently. I'll post cases. And I've just been fortunate that I've been able to bring a group of great like-minded clinicians together, and we're all learning together for one purpose, and that's our patients and just trying to get better all the time.
Yeah, I mean, I really enjoy your the group, WhatsApp group, as you say, they're all like-minded people, and I did mention that to you. Everyone seems to be so nice, and you did tell me that you attract the people like you, who you are. So that really reflects on the group. So I know, and I'm being I mean, I'm not as experienced. I'm not doing as complex cases as you, but I do a fair bit of implant. And people do approach me saying that, I want to start doing implant. And the analogy I give them is that it's not like, you're driving a car. Now you can swap from diesel car to petrol car, and you can still drive it. You don't need that much training. So if you're doing any restorative treatment and you want to upskill in that restorative treatment, that's the analogy. But implant is like you're a pilot of a plane. It's completely different because it's a whole different remit. So do you have like a pathway in your mind when you're advising someone who, let's say, just freshly graduated, but their end goal, they're so focused that they want to do implant? What kind of, if you were to suggest like a pathway, what would you suggest to them? What should they do in order to reach where you are, but they just graduated, or obviously they can't start doing full arch when they just graduated, but they need a pathway. So do you have any sort of advice in mind as to what pathway they should follow?
Yeah, so it's a really common question, and I'm sure, as you said, Dave, you get asked it a lot. I get asked it a lot. And it's always really humbling when I have people come up to me and say, I want to be like you. And I'm like, wow, that's a big responsibility. So if I think back and I've dissected and reflected what I feel is really crucial to developing in surgical implant dentistry, first of all, you need to be in the right environment. And what I mean by that is you want to be around like-minded people. So you don't want to do VT in a small practice where you're not really going to get exposure to implants or surgical dentistry. So you want to be in a practice where they're doing implants, there's opportunities to get involved in surgical dentistry, sedation dentistry, etc. So I think that's really important. And then you want to be around people that are then going to inspire you. So you want to be around people that are knowledgeable and generous with their time to share their experiences and let you watch and maybe assist in what they do. So I think that is crucial, because you may think you want to do a particular specialty or discipline within dentistry, but you won't really know that until you get really, a strong exposure to that. So I think that's really important, and that's your environment. So that's really, really important. And then you really want to start to build a sound foundation in surgical dentistry. So really gets like at taking out teeth, raising surgical flaps, doing wisdom teeth, starting to suture, maybe some soft tissue surgery, etc. in terms of biopsies, frenectomies. You get what I'm saying. So really start to build in a stepwise manner your skills when it comes to surgical dentistry, because that is the foundation to being a really competent implant dentist. So that would be the second thing. And then the third thing is, as time passes, you're in and around implant work, you're seeing a lot of surgical dentistry, you're starting to get involved in surgical dentistry, you want to sign up to a course. And there's such an abundance of courses out there. I often get asked, what course? Well, I said, whatever one suits you in terms of budget, time constraints, time restriction, etc., travel, whatever, budget-wise. Really, you need to do a course because we'll have to meet GDC requirements. The theoretical aspect, you'll start to meet like-minded people, etc. So do a course that suits you. So that's fine. But ultimately, where a lot of the learning will happen is when you're starting to treatment plan and see your patients that require implants. And at that point, you need to have people supporting you to help you treatment plan appropriately, look at CT scans and read them appropriately, and then come to mentor you on a one-to-one basis. I am where I am because I was mentored. People sacrifice their time.
Me too.
For me on a one-to-one basis. And that is naturally... there's an investment, etc., but that investment will come back 10 times in the future. So as there's so many wonderful courses out there, that step where you're getting one-to-one mentoring and you have access to someone that will support you, guide you, assist you to treatment plan your patients appropriately, and then come and help you is where you will really see yourself elevate to a whole new level. So that's what I typically say to new dentists wanting to learn. but it's easier said than done. I have to say that, because
it is. I mean, I usually tell them that, find a mentor first and then do the course, because, you do the course, and I've seen there where people have done the course and then they finished like maybe 3, 4, maybe even 5 implants. Let's say 10 implants they placed. It's not enough to just do 10 implants and just go solo. I mean, you need continuous mentoring. And for me, I am where I am, as you said, because of the mentor. And I had not one, I had multiple mentors for multiple disciplines, because every mentor had their biases. So, you learn one technique, one skill. Let's say you have mentor for implant, then I had mentor for, grafting. I had mentor for soft tissue grafting. I had mentor for my restorative treatments. So, you have different mentors. So I tend to tell people that find a mentor first and then do the course, because if you do the course and if you still can't find a mentor, which has happened, then unfortunately course alone is not enough. You can't really do you can do masters, but if you don't have mentor, you can't upskill.
That's a very valid point. And I feel a question you should be asking the course organizers is who's going to mentor me, and what's the plan here once I do the course, or during the course and I have patients. How am I going to be supported in my development in my own practice? And all credit to course providers. A lot of the courses now are aware that people are looking for mentoring because they know the benefit of it, and they have that boxed off. They have people or that are in the course or previous sort of graduates from the course that will support the mentoring side. When it comes to going back to your practice and having patients, etc. And I think you're right, David, that really is the most important part of it. A lot of work, I see this a lot, and one of the reasons I suppose I set up my teaching the way it is, where mentoring on a one-to-one basis is such a big part of it, is I was involved in a lot of teaching earlier on, and I would see a lot of delegates come up, and they would be learning from great clinicians, but they would never adopt what they were learning. They would go back to practice and it would just be forgotten, and they were never adopting it. And I asked, well, why is that? Why are people investing thousands in learning a particular technique, but when they go back to their own clinics, they're not doing it? And a lot of it is we just, maybe the preparatory side of things, we're not paying enough attention to. I encourage people, if you're going on a course and it's about a new technique, then you should have 4 or 5 patients lined up so you can start to practice what you've learned as soon as you get back, because that's the best time. And that's what I did when I went back in 2018. I went to Brazil to learn zygomatic implants. When I came back, we had patients lined up, and we were, within the next week we were doing zygomatic. So it was still fresh in our mind, fresh muscle memory, etc. And that really allowed me to push on and develop in that particular skill. But I still do. If I was learning something new, it would be the same. I would be looking to come into practice the next week and start practicing what I'd been taught the week before. And I think that is absolutely crucial.
Yeah, I'm guilty of spending tens of thousands of pounds and, going to courses, abroad. And for a week course, I spent £10,000 and came back and kind of implemented almost 5% of it. And my main issue was I learned really having mentor besides me. I struggle to implement anything new without help. And that's why I always have mentor. And, I look back and say, well, I've did these courses, but I haven't implemented. And the time when I haven't implemented is when I had no support after a course finished, and I had no one to go back to and ask questions. And that's when I struggle and I have implemented. So, even though I had cases, but yes, cases, again, when I teach full mouth reconstruction, the way I work, as you know, is, the people sign up 6 months before my hands-on course, and we do treatment planning sessions. They do my online course. So that means that they have patient ready when they come for the hands-on course, because then they can implement it straight away. So, and then after hands-on course, they still support after hands-on course for treatment planning sessions. And I feel that all the course should do that, because they need to prepare dentists to find patient before the course, and then, do the course so that they can implement it straight away. Because having those, I was listening to interview with Drew and a couple of other guys that, when you have these courses and you get, videos of course delegates just finishing the course last minute, like 4:00 of the last day, you get testimonials saying that course was amazing and everything. For me, that's not really a benchmark. My benchmark is like 6 months after, you then record that, you take the testimonial of the dentist after they've done, they implemented the what you taught them, because everyone's buzzing after the course, right? After 2 days of course, they all are buzzing. And that's the time, that's not the time to take the testimonials. The time to take testimonials is 6 months down the line. And that's when we really know what we taught has really sunk in and whether they've used it.
Yeah, and I think that's very, very true. And I suppose that's why we get on, Dev, and I suppose we have a similar philosophy. Teaching is everything to me. For me, it's purpose, it's passion. And what really means the world to me is when I see clinicians being able to do the work that I've taught them independently. And, it just gives me meaning that I've been able to pass on a skill, and now they're rolling with it, and they're getting the joy and the benefits that I've had of many years of being able to do something. And there's so many bonus points, whatever you want to call it, from being able to execute something comfortably. That feeling of doing something, and I'm sure you have the same when you do full mouth reconstruction, it's effortless. Now, when I do full arch implant dentistry, sort of all on 4, all on 6, pterygoids, transinus, it comes very natural, and it's such a nice place to be where you can turn up and it's effortless. You're just, the patient's there, it's your arena, and you're like, give it to me. Whatever happens, I can deal with it. And that's a great place to be. And then when you can pass that on and let another person feel that way, that's magical. And it's not simple. I get messages or x-rays from colleagues, and they're like, look, I did this today. And it just fills me with such joy that they're getting the results that I would get, equally as good as I would be. And that's a great feeling. And, being able to pass a skill on to someone else, that's just the best feeling. So I think that's a big part of what the reason, and something I'm sure you're the same, because we've spoken about this a lot, where if we can pass on something to someone else and then they can roll with it, then that's just awesome. And for me, the real golden nugget is when I have clinicians that I've worked with and they surpass me. That's the real nugget. For me, I want the clinicians I work with to surpass me, to surpass my skill level. That would be the ultimate.
Yeah, unless you teach, and I'm at the same boat as you are, and unless you are teaching and you're seeing that, you don't really understand the feeling you get when someone is really achieving the standard you are achieving without your help.
Yeah. And
it's the best feeling. Even if I do the case really nicely, I don't get that much satisfaction as if someone else who I've taught does the case. Yes. Exactly the same standard I've done it, Yeah. So it's just a completely different feeling that, oh my God, I've managed to, help someone to a level.
Yeah. And the thing is, and I'm sure you're the same, I don't want those clinicians to go, oh, Ferhan, thank you so much. No, nothing like that. But it's just nice to know that, look, this person, they're here, they worked with me, and look where they've got to. Maybe we had a small part to play in that. That's great. But look where they've got to. It's just amazing to be able to unlock something in someone where they're then able to achieve things. And we all need that. And I suppose that's the role of a mentor. We don't really see what's within us, and we need other people to see what we can actually achieve. And a lot of same with full arch implants, full mouth reconstruction. There's a lot of people out there that just don't have the self-belief, the confidence to take on these cases. They have the skill level, or they have the capability of achieving the skill level to get that work and complete that work to a really good standard. They just don't have that self-belief and confidence. And what I see myself, a lot of my work that I do is I give people that self-belief and confidence, because I was there once upon a time, and I just look at them and say, well, you're no different to me. I was there, had doubts and doubted myself and had challenging cases to manage, etc. But I got through it, and I'm doing it now. So you can do it. Come on.
Yeah, I mean, 100%. And as I said, that's a really great feeling. And I hope, you continue, and I'm sure you will continue, helping many more hundreds. And I hope I do as well, because as I said, it's an amazing feeling to be able to help people to achieve, success. Well, thank you very much, Ferhan, for attending today. Is there, before we I'll let you go, is there any tips or any golden nuggets would you like to share with our audience?
Maybe one thing someone asked me, and I don't know. Let me think of the question they asked me. What do you think? What do you think the qualities required to get to your level or get to the position you're in? And I said, it's really simple, because I've thought about this and I've spoken to other colleagues about this. I think there's two things that you need. If I look back in my life, what were the two qualities that got me where I am? And then looking at other people and speaking, two qualities. One is resilience. You just need, I think, resilience and having the ability to just keep going. You've been knocked down. Maybe it's a patient, maybe it's a family situation, maybe it's other colleagues knocking you down. Having that resilience to keep going because you've got goals, ambitions. I think that's critical. The second thing is consistency. You just keep going. Consistency, keep doing it every single day. Keep pushing yourself, keep practicing, keep trying new things, keeping open-minded. So resilience and consistency, you can achieve anything. And if I look back, what are the two qualities that really got to me where I am? It's resilience and just trying to be consistent as possible. Putting in that effort has really helped me get to the position I am now, and hopefully that will, over the next decade, help me get further forward. So hopefully, if you take that away, I think that would be absolutely brilliant. However, I often find when I'm giving other people nuggets or a bit of advice, most people don't listen. And that's not because I don't know, but most people don't listen. But I don't think it's hard to get to the level that you and me are at. I just think it takes that resilience, that consistency, effort, open-mindedness, focused on goals, staying in your lane, not really taking too much interest in what other people are doing, just staying focused. But there's so much noise around us that we get distracted, and it's trying to block out those distractions and just stay focused, and then you'll be amazed at what you can achieve.
Yeah, I mean, talking to a point about consistency, I've thought about that a lot as well, because, I am not consistent in everything I do. So I'm consistent when it comes to dentistry, but there are other aspects of my life I'm not consistent. And, I always ponder that what makes us consistent, and that is something is one to understand, because everyone have consistency in something. Many people are consistent being inconsistent, and that's also consistency, they're consistently inconsistent. Ooh. So, something makes them do that. And if you really self-analyze yourself, you really understand. But I completely agree. I always think when I'm not achieving something, that's because I'm not consistent, Well, thank you very much again for your really good 2 nuggets and the whole hour, on a bank holiday, spending with me, Ferhan. Thank you very much, and I wish you all the best. Guys, if anyone want to do, full arch dentistry, reach out to Ferhan on social media. He is everywhere, literally. So just reach out to him and, or contact me and I can put you in touch with Ferhan. Thank you very much, Ferhan.